Decrivez tendonitis is a very common tendonitis that affects the wrist. It is a wrist tendonitis that affects the outside of the wrist and could affect most people with certain activities. Occasionally it can be traumatically induced, but most commonly it just happens from overuse. A subgroup of patients that gets this, where it's usually very extremely tender, is moms towards the end of their pregnancy or after they've delivered for a few months. It's repetitive lifting of the baby, especially if they have a couple of kids close together. As the baby gets bigger, the repetitive lifting causes pain to the wrist. This can be somewhat disabling. The usual treatment is physical exam, x-ray, and this is usually treated with a cortisone injection over the point of maximal tenderness along with a thumb spike brace, which is worn when the patient is up, removed for bathing and sleep. In addition, some oral anti-inflammatories and or a topical anti-inflammatory gel is used. The majority of these patients can be, this pain can be eliminated conservatively, but sometimes it requires a series of injections, usually a maximum of 3, that are separated by 3 to 4 months. In a very small subgroup of patients, they fail to respond to conservative management after 8 to 12 months, and those patients usually require surgery, which corrects the problem.